In this video, we will be discussing how opioid use can impact expectant mothers. The goal of this video is to advocate for maternal and infant health through creating an informational guide for pregnant mothers. Opioid use during pregnancy can lead to a withdrawal syndrome called neonatal abstinence syndrome, otherwise known as neonatal opioid withdrawal syndrome, which can impact babies after birth. This video will go over the background, consequences, code of action, treatment and recovery, and additional resources for mothers. If you're an expectant mother and struggling with opioid use, you might find this video helpful. Here are some helpful definitions to know about this topic. Neonatal abstinence syndrome is a group of conditions that can occur when newborns withdraw from certain substances, including opioids, that they were exposed to before birth. Neonatal opioid withdrawal syndrome is often used interchangeably with NAS, but is specific to opioids as the cause. Opioid use disorder is a problematic pattern of opioid use that causes significant impairment or distress. And medication-assisted treatment is the use of medications in combination with counseling and behavioral therapies to treat opioid use disorders. Next, we will discuss some of the ways infants can be affected by prenatal exposure to opioids. So how does opioid use during pregnancy affect a newborn? Infants can be born premature and have lower birth weight, which puts them at risk for longer hospital stays and rehospitalizations. After birth, your infant may experience some signs of withdrawal such as hyperirritability, poor feeding, vomiting, and dehydration. But don't worry, there are actions you can take to prevent this from occurring. Infants can also be susceptible to long-term outcomes. During early childhood, children with NAS are more likely to experience developmental delays such as speech and language impairment. They may also experience motor, cognitive, vision, ear, and sleep issues. So let's talk about what you can do. First, identify if you have an opioid use disorder. You might be able to identify if this is the case if you are having uncontrollable cravings and you experience inability to control opioid use, even though it may be having negative effects on your personal relationships or finances. Second, understand what NAS or NOWS is and its consequences. Lastly, seek treatment and recovery services. Here are some options available to you. If you are pregnant or planning to become pregnant, speak to your primary healthcare provider to create an individualized treatment plan unique to your needs. This would support healthy development of the fetus and prevent future complications for both you and your child. There are also postpartum psychosocial support services, such as substance use disorder treatments and relapse prevention programs. Pregnant women are advised to not abruptly stop opioid use as it can cause serious consequences including preterm labor, fetal distress, and miscarriage. Instead, it is recommended that they utilize MAT and it should be continued during their postpartum period. These websites provide support through offering free and confidential services, treatment referral and information services such as mental health and healthy pregnancy education, as well as assistance in finding treatment facilities. Visit to learn more about what they offer. Make sure to click the description box below to locate our other social media platforms as well as links to the additional resource websites. Thank you for watching!